the acronym is TEAM. And what it is they have certain categories, like hip replacement, um, osteoarthritis, certain procedures that these hospitals are going to be a pilot in, and they're going to receive money for the patient's procedure and aftercare specifically related to those surgical procedures. And I'm
Are they
like,
going to be inpatient? Are all the procedures
inpatient,
inpatient only? I wonder if they're
yeah,
inpatient only procedures,
they
and they're
are.
monitoring them and watching them. Because I remember once upon a time they were stripping all of them. That one year, that one year they took everything off of the inpatient only list, and they were going to do away with it. And folks went ballistic and up in arms. And the very next year, they all those codes came right back, and the list has been there ever since.
Because I think that they're trying to see with these cases, like, could, like, do they have to be, probably.
This is probably what they should have
Testing it
done
out.
before they stripped them off. Because, like I said, folks went bananas. Like, no, this is we need this. We got to do this. Da 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 da. You can't. And the outpatient people was like, come on. The surgery centers were like, yeah, let them go, let them go. We got you, we got you. And then they were like, I guess the hospital associations had probably more money, and they lobbied a little harder, and they were like, oops, our bad. We're bringing them all back.
Because the only thing about, outpatient procedures is, I mean, of course, with any procedure, you run the risk of complications, but I've seen some outpatient procedures with some very, very bad complications that aren't
Hmm.
necessarily expected.
Yep.
And it's like they come to the ER a complete mess.
Mm.
I mean,
I
right
think.
after the procedure, like vascular procedures where they have internal bleeding, all
Mhm.
kinds of hypovolemic shock, all kinds of stuff.
Mm. That's
I
crazy.
think some. I think certain procedures should just only, even if you could have done it safely outpatient. I think they should be inpatient because it just requires a different level. Like, unless you're just going in and getting a DNC or something, or just getting your toenail debrided, I feel like you should have the patients in there, because the way that the economy and how everybody's health is right now, what happens if something take a drastic turn at a ambulatory center? You know what I mean? Like, you got to stop everything. You got to stop the whole production and then shoot them over there, because most of the time orthopedics, that's where they try to be at, the ambulatory center, not necessarily at the hospital all the time, unless the patient has comorbidities that force them to have to be into the hospital and be inpatient.
Yeah,
I
I
don't know.
think I appreciate that they are doing this testing early on, because in some cases there are times when a hospitalization may not be necessary, and the
Hmm.
cost of inpatient care is so expensive and rising. And you run into, is this going to be covered, is it not, and then the patients end up paying for that. So I feel like the option of, again, once they test to see whether or not it truly needs to be something that has to be
Right.
inpatient, I think the option of having these surgical centers or outpatient locations have a part of that is good. I think it's good for it's good all around. Um, because at least the ones that I'm familiar with, they are, they're not just like some fly by night. Look, I'm about to throw somebody under the bus. Urgent care kind of thing. They like for
Right.
real. They like real. You know what I'm saying? They have the expertise, the team, the people. They know what they're doing. Like you said, especially orthopedics. And I'm thinking about the hip replacement kind of thing. Especially as we are in the decade of the baby boomer, because they everybody out here and they booming,
Right. Right.
and they
So
getting
Booming and
replacements.
having catching stuff on the side, because they booming too much.
I pulled it up on LinkedIn, and it says the team stands for Transforming Episode Accountability Model,
Okay.
and it
Did
will
you
begin.
post it in the thing?
No, I will.
Okay.
And
Oh, well, we could do it when we come back.
It'll begin January 1st, 2026, and last 5 years. And it says
Ooh.
Mm.
hospitals for
And how many
selected.
they get?
Thir- uh, you mean how many hospitals?
Uh-huh.
Oh, 741.
That's a lot.
Yep. And it says the model was designed based on lessons learned from previous models of input from stakeholders. Selected hospitals will coordinate care for traditional Medicare beneficiaries undergoing certain procedures and be responsible for the cost and quality of care for the surgical episode, as well as 30 days after patients are discharged from the hospital. The procedures within the bundle are lower extremity joint replacement, hip femur fracture treatment, spinal fusion, coronary artery bypass graft, and major bowel procedures.
I knew
Bless
And they
ortho was
even,
gonna be in there somewhere.
and they even list the all 741 hospitals in their.
Oh wow.
And this is on, of course, our people at
Lynch.
Becker's
Oh, is
and
it?
from.
Okay. 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 All right. Yeah, yeah, yeah. We'll definitely link that information in. Cool, cool.
So something
And I
crazy.
posted in the comments. Do people
I don't
do
see it.
people? Okay, hold on. I just did. Well, it's
There we go.
posting now.
There we go.
Okay.
There we go. So check the comments. What were you about to say, Miss Mimi?
Um so I was reading, I'm always on Facebook. So it says the headline was Alabama man dies when Florida surgeon allegedly removes wrong organ.
I
He went
saw that.
in. He went in for his spleen. Tell me why they removed the man's liver
Yep.
and he
Because
passed
they don't
away.
know they right from they left when they looking at the person. Wow. But they don't look alike though, right? Like
I had so many questions because don't you do a check at the beginning to locate? You know, you got to do the side of the body. This is the patient.